Good morning. Welcome. Thank you for joining us. I'm State Representative Christy Pagan, and I serve the 21st District, covering Canton, Belleville, and Van Buren Township. Throughout the country, we have seen relentless attacks on women's health, with the passing of medically unnecessary restrictions and all-out bans in many states. We must be proactive in upholding healthcare access right here in Michigan. Today, we are proud to introduce the Michigan Reproductive Health Act, or the RHA. The RHA guarantees that individuals are free to make their own personal decisions about reproductive health care. That decisions should be based on medical facts, not political ideology. This legislation also removes current barriers to reproductive health care by repealing outdated and dangerous restrictions and brings it in line with the treatment of other forms of medical care. We need the RHA here in Michigan because every resident has a fundamental right to make their own decisions about contraception, abortion, and pregnancy. We cannot know a woman's circumstance or the factors that go into her decision-making. Only she can know that. Reproductive health just got very personal for me. I am currently 6 months pregnant and expecting twins, and I could not be happier. But for many women, the reality of a pregnancy leads to complex and personal decision-making that no one knows better than the woman making that decision herself. So when I think about raising my soon-to-be children, I will teach them that their bodies are their own. I will tell them that no one should ever make them feel violated or unsafe or harm them. We protect our children and empower them to have personal autonomy. But when it comes to a woman who can get pregnant, that's when certain politicians interfere. That's when we reject medical standards, medically sound advice, and medical science. That's when a woman's body is no longer her own. That's why today, myself and my colleagues say enough. We all have had to make medical decisions that determine the directions of our lives and our health. And reproductive health should be no different. We must pass the Michigan Reproductive Health Act and regulate abortion care like all other forms of medical care, and leave important, life-changing decisions between a patient and her doctor. By protecting access to reproductive health care and trusting women to make decisions that's right for them, this bill reflects the majority of the people across our country and our state that believe that women should make their own personal medical decisions without certain politicians interfering. To talk more about this package, I welcome my colleague, State Representative Rebecca Warren.
Thank you. Thank you, Representative Pagan. As many of you know, I am State Representative Rebecca Warren. I have had the pleasure and privilege of representing Ann Arbor and the bulk of Washtenaw County for 13 years now in the Michigan legislature. And I'm proud to stand here today with my colleagues because reproductive health care is health care. Abortion care is health care. And we have worked so hard during my entire career here in Lansing to expand all kinds of health care, physical health care, mental health care, prescription drug care. And why we are gathered here today is to make sure that all of the citizens of Michigan know that we're fighting for their reproductive health care as well. Standing here today, we know if we look at Michigan's enacted statutes, our state has placed lots of arbitrary and medically unnecessary restrictions specific to one particular type of health care, some of which you heard Representative Pagan detail a few moments ago. But because no two people have the exact same experience or circumstances, every person in our state must be empowered to make complex and deeply personal decisions for themselves when it comes to any form of health care, including reproductive health care and abortion. These are decisions that must be made on the advice of medical professionals they trust, their personal values, and what they feel is the best decision for them and their family. Throughout the nearly 13 years I've spent in the Michigan legislature, I've watched a small group of political ideologues let their personal opinions restrict access for the rest of us and our children. It's time for that to change. It's time to allow Michiganders to receive the high-quality, constitutionally protected health care that they deserve. I will now turn things over to Dr. Sarah Wallet, a healthcare provider who will describe the importance of letting experts like her offer appropriate medical advice and care to their patients. Dr. Wallet.
My name is Dr. Sarah Wallet. I'm a practicing physician in OBGYN and the Chief Medical Officer for Planned Parenthood of Michigan. Every day I go to work, and every day I strive to live by the oath of all physicians, that the health and well-being of my patients is my first consideration, and that at all times I will respect the autonomy and dignity of my patients. The increasingly restrictive, short-sighted policies enacted in Michigan make it harder and harder to uphold that oath for my patients seeking reproductive and sexual health care. As a doctor, it's my job to give my patients the best care, and that's determined together. I don't tell them what to do. I give them their options, we talk about it, and then they make a decision. And that's exactly why we need a Reproductive Health Act. Right now, every pregnant person in Michigan's options are limited by policy, not by medicine or science. And as a physician, I am unable to abide by my oath. People who need an abortion can get one after waiting an arbitrary amount of time and reviewing state-mandated materials, after paying out of pocket because many insurance companies won't cover it and don't offer riders, and after driving, sometimes across the state, because onerous regulations make it harder for abortion providers to stay open. What the RHA does is restore the intent of Roe v. Wade, that people who decide, in consultation with a physician and the people they trust, to have an abortion can get that care without any of these deliberately enacted obstacles that do nothing to improve it. The Reproductive Health Act guarantees that people are free to make their own medical decisions without interference by certain politicians. That's why I am here. As a physician, I can tell you that the politicians who've been putting themselves into exam rooms have no business being there. I watched a few months ago as state legislators were stunned to learn in a committee hearing to ban abortion later in pregnancy that physicians like me actually provided options, procedure descriptions, and counseling to their patients before receiving abortion care. Think about that for a second. The people pushing policies that harm patients don't even know the very basic mechanics of the care they are trying so hard to outlaw. It is because of their ignorance and insistence on being present in exam rooms across the state that we need this act. Michigan needs to commit to all of us, doctors and patients alike, that reproductive health care, like cardiology and sports medicine and pediatrics, will not be dictated by politicians. Doctors like me who hold themselves to a code of ethics that puts the health, autonomy, and dignity of our patients first. We demand it. I'm going to turn over now to Representative Sherry Gay-Dagnogo.
Good morning, and thank you, Dr. Wallet. My name is Sherry Gay-Dagnogo. I'm state representative of the 8th House District representing the city of Detroit, and I'm honored to stand here this morning along with my colleagues who are advocating for women to have the right to govern our own bodies. Our selective health care should not be a partisan decision. I'm certain all of you have had a chance to visit your doctors at one point or another, and none of them have ever asked, are you a Democrat or a Republican, before they begin to administer health care. We have to get the politics out of our doctors' offices and out of our health care rooms. Our state's overall health care system is filled with inequality. So it's unfortunately not surprising to many of us that reproductive health isn't any different. Personal opinions and political ideologies have effectively restricted access to important reproductive medical care for thousands across our state. But in urban communities and those who are impacted by poverty, women of color, and young women, this is even more alarming. They're often forced to face the greatest impacts of these barriers. And frankly, it's unacceptable. It's unconscionable for Michiganders to live in a state where the color of your skin, the community you call home, and your age, or how much money is in your bank account, actually serves to further compound the barriers already in place when accessing important medical care. Studies have consistently shown that women who are prevented from accessing reproductive health care options are more likely to fall into poverty or for poverty to be perpetuated. We're better than that as a state, further perpetuating a cycle of harms so many Michiganders in this process. That's why solidifying and securing health care protections and removing barriers to equitable access is so critically important. The time is now to stand up, to take action, and to protect reproductive health care in Michigan once and for all. We can do that, and I'm so proud that we're standing here united. It's amazing to me that choice seems to be an option in a number of other key areas by some of my colleagues, but choice and the decision over our own bodies becomes restricted. I'm proud that leading our state, that I'm introducing our governor, Governor Gretchen Whitmer, who's standing united today for us to fight and to stand for reproductive health care. Thank you.
All right. Well said, Representative Gay-Dagnogo. I am grateful to have all these phenomenal leaders in the House and in the Senate who are taking this fight straight to the people and having this conversation that is incredibly important to so many people in our state. We've seen our rights under attack. There are people in this very building who are dead set on restricting a woman's right to choose here in Michigan. They've already passed a bill to ban a safe procedure that has saved women's lives. And as they know, I'm going to veto those bills if they ever have the backbone to send them to my desk. But it's not just a pen that should be protecting women's rights. They should be enshrined in law. We know that this is not unique to Michigan. We know that there's been a nationwide effort to interfere with women's medical decisions. From Alabama to Georgia to Ohio, states across the United States are pushing through legislation that takes away women's rights to autonomy, to our own bodies. We cannot let up for a second. And that's why I'm grateful that this group of leaders has come together to push for real reforms and real protections under the law. That's why the work that they're doing is so incredibly important. The Reproductive Health Act guarantees that people are free to make their own medical decisions without politicians interfering. No one can know a particular person's circumstances or the factors that go into their decision-making if they are not walking in her shoes. But we do know that these decisions right now should be left to each individual based on the advice of their healthcare professionals, based on her own personal values, based on what she knows to be best for herself and for her family. The most important economic decision any woman will make over the course of her lifetime is whether and when to bear a child. Nobody needs or wants politicians to make these decisions for us. When it comes to making decisions about our reproductive health care in Michigan, a woman's decision should be based on medical facts, not political rhetoric or ideology. The Reproductive Health Act will ensure that women in Michigan can rest easy knowing that they are in charge of their bodies. These leaders here today are doing the hard work. Now that the bills will have been introduced, it's time for the rest of the legislature to listen to the members of these members of the legislature. I want those other members to think about this. Someday a woman that they know may need an abortion to save her own life. She may need one to ensure that she can care for the kids that she has or to be in charge of her future. Her decision will be based on her own unique circumstances, and she and others like her in Michigan need the support of health policies that are based on medical expertise and access to care so that she and her doctor can decide what's best for her, not from politicians.